Welcome friends to the MedPro check, and this is our next video on the important question of anatomy which are mostly asked in the MHS nursing exam. So first of all we will see the importance of general anatomy. That's the classification of bones according to its shape, then blood supply of the long bone, sineval joint with its classification, and then difference between arteries and veins. Then importance of the upper limb are shoulder joint, cubital fossa, bicep brachii muscle, axilla and deltoid muscle, brachial plexus with its branches, and tricep brachii muscle. Then importance of thorax region. First important organ is heart, which is mostly asked about for 15 or 10 marks. First one is the gross features, then blood supply, right atrium, then pericardium and applied of the heart. Then second one is the lungs. Importance of the lungs are gross features, then different between right and left lung, bronchopulmonary segments, impression on the mediastinal surface, porta hepatis or roots and its arrangement of the internal and external structures in the porta hepatis. Then mediastinum, first one is divisions, mediastinum ka divisions, then boundaries of each division and content. That means each division में कौन से कंटेंट आते हैं वो. Then another one is the breast का structure, then blood supply, lymphatic drainage and applied anatomy of the breast. Then comes on the lower limb. Importance of the lower limb are hip joint, then femoral triangle, popliteal fossa, muscle of the gluteal region and also structure under the gluteal muscles and adductor canal. Then abdomen and pelvis, first organ is important. Stomach, first one important parts in the stomach are its location, then gross feature, blood supply, part of the stomach, then stomach bed, which are the posterior relations of the stomach, then lymphatic drainage and applied anatomy of the stomach. Another one is the kidney. Important points in kidney. First one is its location, gross features, relations, blood supply of kidney, venous drainage and applied anatomy of the kidney. Then third one is pancreas. Location, its gross features, parts, relations, functions, blood supply and applied. Fourth one is liver, its location, its lobes, bare areas and applied anatomy. Then intestine, different between the large intestine and small intestine, then movements of the intestine and duodenum in detail. Then appendix shape and location. Then another one is the spleen, its location and ligaments are important. Then diaphragm, its parts, its central tendon and its opening, how many openings have diaphragm. Then urinary bladder, first one is its location, then parts, gross structure, then relation in male and female, which is the another important question mostly asked for 5 marks. Then male reproductive system, first one is testis, short notes on testis and spermatic cord, that is the content of spermatic cord. Then female reproductive system, very important question is uterus. First one is relations, supports, parts, applied, and another one is another point important in uterus is its angulations, which comes under the supports and parts. Then head and neck, first one is tongue. Nerve supply of tongue is very important for 5 marks. Then another is eyes, its structure and muscle help in the movement of eyes. Then thyroid gland, its location, parts, relation and applied anatomy of the thyroid gland. Then sternocleidomastoid muscle, then paranasal sinuses, and last one is our brain. And important points which mostly asked in the brain topic is CSF, its function and circulation, then function of the hypothalamus, then sulcus and gyrus on the superlateral surface of the cerebellum and functional areas on the cerebrum. Then some tricks which we follow for write the answer. First one is first trick or criteria for how to write the muscle. So first one we have to write the location, then its origin, then write the insertion, then blood supply, nerve supply and applied anatomy of the perspective or muscles which ask in the exam. This is the simple criteria to get the full marks for muscle. Then how to write the joint. So this is the criteria for to write the answer for any joint. First one is location, then it type, subtype, articulatory surfaces, ligaments, action, nerve supply, blood supply, and applied along with its diagrams. Then how to write the cubital fossa, femoral triangle or popliteal fossa. First one we have to write the location, then definition, then boundaries, then roof, floor, content, and applied. So these all questions are the mostly asked in the BSc nursing exam in MHS University. If you like this video, then please subscribe to my channel and keep support. Thank you friends.